Well, here I have Greg, and it's been about 5 weeks since he had his high dose laser stem cell and true dose platelet rich plasma therapy for the avascular necrosis of his right hip, degenerative arthritis for his knees, and degenerative disc disease for his spine. And you were mentioning about the hip clicking. Could you mention about that? Yeah.
Yeah, I mean, it's subjective, but it definitely is less clicking than before the stem cell treatment. And the level of clicking is more reminding me of the clicking I had going on 8 months to a year ago.
So if you had to, I know it's hard, it's subjective, like how many percent less clicking are you feeling and hearing than before?
30 to 40%
Okay, that's
less.
pretty significant. It's only been a month. And then are you taking as many opioid pain pills as before?
Unfortunately, I hadn't taken any, and now the pain has gotten bad enough again where I've started taking opioids.
Okay, but in the first few weeks, you didn't need to take them at all.
The first few weeks, so I was surprised. One thing I was pleasantly surprised, I'm apparently not habituated. After all that use,
Not
I was
addicted.
able to just instantly put them down the first second I could.
All right, but it looks like since the pain's starting to come back, we're gonna give you a shockwave treatment and some laser and decompression just to get some pressure off that joint.
It's really hard with that belt to catch everywhere in that hip. It's like
We're gonna
if I
put
do my knees
there's
once.
another table that's gonna, it's called Back on Track. It decompresses your spine and then it goes side to side to unload that hip. So we'll do that for you.
Okay, because if I do like one treatment on my knees or my back, I'm doing 4 treatments on my hip a day,
Yeah, yeah.
trying to hit different spots.
Yeah, for the light stim, but as far as the treatments here, we'll focus on that hip, okay?
Okay.
And it looks like we're about 5-10% improvement. That's all we really want. It's a year program. It took decades for your hip and back to wear out. Give it a year to regenerate, okay?
All righty.
All right, we'll keep on plugging away. So let's get you treated. All right.
Yeah, and you're thinking that at some point you don't think I should keep doing the hyperbaric, or?
Well, you've had about 40 sessions, so usually you do them in cycles of 40. So maybe you could save the 15 after you have your PRP booster. So yeah.
No, he doesn't price it that way. He
Okay.
gives you a